The COVID-19 pandemic started with a healthcare system already in disarray. Unhealthy work environments, coupled with burnout, moral distress, and inadequate staffing, were widespread in American healthcare. 2 years later, the situation remains upended, with healthcare workers receiving the brunt of the impact. As we consider nurses' role in setting things right, we can't forget we will only achieve our goals with the right connections. As nurses, we understand connections. It's what we do. Connecting means more than networking. It is an anchor that brings meaning, purpose, and hope to our lives. It opens doors and opens minds. Connecting creates bonds that validate and leverage the change we seek. We show how nurses heal with our hands, soothe with our words, and build collaborative bridges to encourage understanding. As a community of acute and critical care nurses, we are connected through our lived experiences, our commitment to patients and their families, and our advocacy for a different and better future for healthcare. We are nurses, changing the narrative. Our aspirations are as monumental as our commitment to taking them on boldly, because we are committed to bring about fundamental change. We can accomplish some of this change on our own, some of it in collaboration with others, and some of it by supporting others who will do it themselves. The Hear Us Out campaign told our story. We challenged the public to help us help them by showing how to have meaningful conversations to overcome vaccine hesitancy. Relentlessly promoting and supporting healthy work environments, better staffing and retention of nurses, less moral distress, and lower rates of workplace violence will become the norm.
AACN has been a leader in advocating for the importance of healthy work environments for nurses for over 2 decades. And this past year has been no different. In the fall of 2021, AACN conducted its 5th national survey to check the status of the nurse work environment. And as I'm sure is no surprise to any of you, we found a decline in the health of the work environment since 2018.
When in-person events returned after 3 years, 3,500 nurses gathered at AACN's annual conference, NTI, for a week of learning, sharing, healing, and growing. Powered by the Dear World Project, nurses used their own first-person narrative to reveal their lived experiences and aspirations. By offering gold standard credentialing programs and launching the first micro-credential for acute and critical care nurses, the COVID-19 pulmonary and ventilator care micro-credential, we continue to drive patient health and safety, advancing practice consistent with standards of excellence. Seated at influential tables, sometimes we invited ourselves. We have new connections at the White House, the Office of the Surgeon General, the National Academy of Medicine, the CDC, and the Joint Commission. With these powerful partners, we can elevate how we advocate for our community of acute and critical care nurses. With 4 other highly influential healthcare organizations as partners, the National Nurse Staffing Think Tank challenged employers to achieve a standard of appropriate staffing that benefits patients, families, and nurses alike.
Some of the actionable items that came out of the think tank that are being expanded upon by the task force include the need for a healthy work environment in which nurses are as physically and psychologically safe at work as their patients, as well as the need for really looking at how we staff to provide flexible staffing and total compensation opportunities for nurses.
Town halls now let us experience the power of community in a new way by drawing from a wider range of individual viewpoints to influence our unified voice. We saw leadership through individuals who brought together teams to discuss and solve challenges. AACN-supported programs such as the CSI Academy, Beacon designation, and local chapters provide nurses with the knowledge, skills, and support to make change.
The CSI Academy was very innovative when we switched to a virtual delivery model, and we had 2 cohorts complete during the past fiscal year using this model. The CSIs demonstrated their resilience as some of them experienced up to 4 COVID surges, yet they were still able to carry out their projects. The teams had an impact to the hospitals, to the patients, to their families, and more importantly, to the nurses themselves. How would I describe the CSI Academy? Priceless.
Nurses in the AACN Clinical Scene Investigator Academy cohorts learn to lead their peers in creating unit-based changes that can be easily scaled for maximum impact. The Beacon Award for Excellence recognizes evidence from individual patient care units that distinguish themselves by improving every facet of patient care. Chapters bring connection, learning, best practices, and professional development resources as AACNs face in a local community. Awards, grants, and scholarships provide community members with meaningful recognition by celebrating professional achievements, discovering new evidence, and supporting lifelong learning. As a community, we have never been more united in our fierce determination to protect not only our patients and their families, but our own physical and mental well-being. The story of the future of nursing and healthcare is unknown. There will be great victories and also great challenges. The next chapter of our own story will be written, and we are the ones to write it by speaking up, making connections, and leading change, starting